Preserved foods increase the risk of NPC, Rohaizam. So you mean I can't consume my ikan masin anymore? Hi, my name is Nur Fadhlina Abdul Satar, also known as Dr. Nina, and I'm an oncologist. I treat cancer patients with radiotherapy and drug therapy, for example, chemotherapy.
Hi, I'm Dr. Rohaizam bin Japar, and I am the ENT head and neck surgeon.
Today, we're going to talk a little bit more about nasopharyngeal carcinoma or NPC.
What is nasopharyngeal carcinoma?
Right. Nasopharyngeal carcinoma or NPC is really a cancer arising from the lining of the back of your nose, near the base of skull. A lot of Malaysians would call this nasal cancer. One famous person who's had NPC is Datuk Lee Chong Wei. Why is NPC more common in Southeast Asia?
Basically, it is more common because of our genetic predisposition, dietary intakes, and EBV infection. Yeah.
Did you know, Rohaizam, that in Malaysia, NPC is the 6th leading cause of cancer? I mean, the top we have breast cancer, but NPC is at number 6, meaning that a lot of Malaysians are actually having this disease. So we do need to talk a bit more about it.
Yes, correct, Nina. Most of the time, we don't aware about this because we only see like topmost lungs, breast, and everything. The NPC is basically a very small area, but can cause a lot of problems because it can connect to your brain, your sinuses, your throat, and everything, and especially our nerves.
But in Malaysian, in terms of race, Rohaizam, the Chinese population seems to be having the highest risk of NPC. So incidence of 1 in 100 in comparison to Indian population at only 1 in 1,000.
Basically, it's quite rare cancer for the Indians, but it's very common cancer for a Chinese.
But also in East Malaysia.
Yeah, especially in Bidayuh's population and Kadazan Dusun, something like that. It's very common. Could frequent nosebleed be an early sign of NPC?
Absolutely, yes, it can, but nosebleed is a very frequent symptom. So not every nosebleed means that you have NPC. However, if you're having it frequently, you should get yourself checked out by a doctor like yourself, Rohaizam, by an ENT surgeon, who will then do a scope to have a look at the back of your nose to see whether there's any growth that could be a cause of NPC.
Yes, correct, Nina. I agree with you. Nasopharynx is a hidden place.
Right.
Okay. It cannot be detected when you only see at the anterior side of your nose. You need the endoscopy to see. It can be done only in clinic.
Right.
It's very fast procedure. All right, a fast procedure, and probably it's less painful.
Does consuming a lot of preserved foods increase the risk of NPC, Rohaizam?
They have some link between preserved food and NPC. I would say yes. Okay, because of in the preserved food or salted food, they contain nitrosamine, which can directly link to the development of NPC.
So you mean I can't consume my ikan masin anymore?
People with a higher consumption of a salted fish has higher risk, but doesn't mean that you cannot take it in moderation. Is there a role of surgery in NPC management? Basically, the mainstay of treatment of NPC is radiotherapy. Okay, and sometimes we add on chemotherapy. Surgery is only in selected cases. How effective is radiotherapy for treating NPC?
So I am a radiotherapy doctor, and clearly I'm going to say that radiotherapy is really very effective in treating NPC, especially when they're caught early in stage 1, 2, or 3. Even in stage 4, there is a role for radiotherapy to play. Yes. So radiotherapy is outpatient treatment where you come and go to hospital, so you don't have to be warded in hospital for a prolonged duration of time. But radiotherapy is a long treatment, meaning that you have to come and go daily for about 7 weeks. So how can patients prepare themselves for NPC treatment, Dr. Rohaizam?
to help to reduce the side effect of radiotherapy, you need to avoid smoking, lifestyle changes, okay, reduce alcohol consumptions.
Stopping smoking is the number one thing that we advise our patients that are going through radiotherapy because it can reduce radiotherapy side effect. But clearly, in terms of reducing risk of the cancer coming back, adopting a healthy lifestyle is definitely what we advise all our patients in terms of eating a healthy, well-balanced diet full of fruits and vegetables, a bit less on preserved food. So fresh food is what we suggest, and an active lifestyle is what we propose.
That's all the question regarding NPC we have today.
If you have any questions or comments on NPC or head and neck cancer, please leave them in the comment box below.